This is about call to action for you guys, and I feel like you've been doing this all day. So I was coming up here trying to inspire you to commit to action, and you've already done that. So I feel like a lot of what I written down was not very helpful. But I want to start by thanking you for your engagement. This was a long day with a lot of content. You have another day planned tomorrow. Um, Brian had come up to me shortly after our symposium in October. We had about 400 healthcare providers there. Many of you were there. I know Christy presented the work at ERMAC. And he said, hey, HCA wants to replicate this. And I was like, well, that's great. And let's see if that happens. And here we are. We recently engaged a leadership coach to come help our team with some different things. And one of the things they talked about was doing real work. And real work happens when one of three things happens. Either you make commitments, you deliver on those commitments you make, or you secure commitments from others. And this is exactly what you guys have done. So I couldn't be more proud of all the work that you guys are doing here. It's the first time I've been part of 4 OPOs for 22 years, and I have not seen a health system come together and saying, hey, we want to prioritize making our system better, managing the donation program. So thank you all for kind of your commitment to making donation better. We just recently had what was called the Transplant Growth Collaboration, where we brought together high growth transplant programs from around the country. Here in Salt Lake City, we were the first OPO to host one of these. And the goal was to try to learn what culturally was evolving in those transplant programs to lead to year over year growth. And Intermountain's liver program was one of those programs, and they had grown 367% over the last 5 years. And one of the things they talked about is they wanted to be a transplant hospital, not a hospital that does transplants. And that's a mindset shift, that's a culture. And I really started feeling that when I was here, when we were talking in your breakout sessions and when you came back and reported about what are the things that you want to do in your respective hospitals to grow donation. I had that same sense of that same feeling I had when I was listening to Intermountain. You talked about Max and kind of to his commitments, picking up extra shifts to continue to support that family in that process. The SSCs that you're going to be developing to really prioritize making sure that if there is something that happens, that a root cause analysis is done. That is a culture shift. That's a mindset shift. And one of the things that we talked about in these growth collaboration meetings was that there are programs that are successful in the same system that other programs are operating in, right? So they have the same constraints, yet they're finding ways to grow year over year with their transplants. And I think we can, sorry, my nose has not stopped running now for a year since I lived in Salt Lake City. I'm not sick, it does not stop. And when I give presentations, it runs even more. So you're gonna hear me sniffle, and I apologize for that. But there's, hospitals, ERMAC shared their story, Ogden Regional, I don't know where Megan went, but shared their story of kind of reducing those missed opportunities, and they're operating in very similar constraints as every other hospital. So it can be done. And I think the thing is for all think about is, why is it that we're here? Why is donation important, and why are we focusing on this? One, it's the right thing to do. One of the things we also talked about at this leadership meeting was what is vision? Right? And there's management vision. It's like, how do I best utilize my resources to accomplish this task or this outcome? We also talked about leadership vision. And that's a little bit different. That's like, how do I use my circle of influence to meet the needs of others? And certainly, I think we can all appreciate the needs of others. Here are the 104,000 people who are waiting for transplant. People like Jill, who spoke earlier, Brady from Donor Connect, while he was lucky to have a living donor kidney. If not, he would have relied on our system. And I think all of you here now have your own respective circle of influence, right? Certainly, Dr. Ross and Brianna brought this together. They used their circle of influence. They made a commitment to make this donation, a symposium happen. They secured commitments from Brian, saying, hey, bring in those same speakers, bring in Nika, bring in Alex Glazier to help inform, and now we're delivering on those commitments. But you have now all have your circle of influence to go back to your respective hospitals and saying, these are the initiatives that we're going to deploy. There's also the regulatory reason. We talked about those, right? Certainly the conditions of participation. This is the core tenet. This is the funding for your hospital, for your Medicare patients, is that you follow these conditions of participation. Yet every hospital on the scorecard is not met. in each one of these categories. The problem is there's no real bite to this regulation yet, and I'm going to get into that. We have shared accountability as well. So you have the conditions of participation, we have the conditions for coverage. So as organ procurement organizations, we are federal contractors operating on contracts from the Department of Health and Human Services. And CMS recertifies us every 4 years. Well, the Trump administration passed the Advancing American Kidney Health legislation in 2019. And the goal there was to double the number of kidney transplants by 2030. And also it created increased accountability for organ procurement organizations, saying that we're not doing enough to serve the needs of the people who need organ transplants. So for the first time ever, they have changed our monitoring system, and they came up with 2 metrics, a donation rate and a transplantation rate. And what they're saying is now you need to be in the top quartile of all 56 organ procurement organizations in both of those categories to be automatically recertified. If you are not in the top quartile, your service area is up for competition. If you're below the median for both of those, you will be decertified. And 2023 set the benchmark. This is the evaluation year. So this is the most critical year for OPOs since the formation of OPOs. So theoretically, in a couple years, there could be 20 less OPOs operating if CMS moves forward with this. So we have felt this increased accountability on OPOs, the increased scrutiny. If you read any article, it's the donation and transplantation system is failing. We're not doing our job. And we as OPOs have felt this heat. And for the first time, we have seen a bit of a shift. And last week, they proposed legislation that's going to start holding transplant centers accountable. Now, for kidney transplant programs, they're going to have to meet a certain score. There's a certain proportion of the score that's dedicated to have they grown transplant volumes over the previous couple years? What are their outcomes? And what are their acceptance rates? They can no longer decline kidneys and then be okay with it. And their reimbursement is going to be affected by that. So there's an upside risk. So if they're in the top scores, they're going to get more reimbursement from CMS than they have in the past. If they're in the bottom scoring system, they're actually going to owe CMS money. So now there's a financial incentive to either grow, or you're going to have to pay CMS back for the fee for service that they're getting for kidney patients. The reason I bring this up is because they're starting to hold the system accountable. This is a highly interdependent system. We can't do what we can do without our donor hospital partners, and the transplant programs cannot do what they do without us managing the donation process and providing organs for them. So you can expect who's going to be next in this accountability, and it's the donor hospitals. So that is the reason I think we are trying to bring visibility to the opportunities that we have as a system. So the scorecards that Brian talked about earlier that are in your packets, that's going to create visibility to the opportunities that we have to improve the system. I'm proud to say that Donor Connect in 2021 was the top performing donation program in the country. So we're not at risk for being decertified, but we recognize that we have a lot more that we can do, and that was evident in the evidence and evident in the data that Brian has shown. We also recognize that donation is a high acuity, low frequency event. So while this is all that we do, we recognize you guys do a lot more, and donation doesn't happen that often. So we're your partners. We're your partners in this, and we're here to help you with any initiatives that you want to do to grow or improve your processes. I would argue and say that your peers are also there to support you. We heard from ERMAC and Ogden Regional about the things they've done to grow their programs and reduce missed opportunities. So we're all here collectively. We have a shared accountability to make donation happen. The last thing I'll share, and probably this is where I do want to inspire you for the next session when you guys break out, is about bold aims. We had talked about it in a recent meeting when John F. Kennedy said, within this decade, we're going to send a man to the moon and return him safely back to Earth. Now, he didn't coordinate with all his engineers before and say, hey, can we actually do this? Can you help me figure it out before I put this out there? He said, this is what we're going to do, right? And sometimes it happens organically. I'm sure Ogden Regional didn't say, hey, we're going to reduce our missed opportunities from 63% to 16% by this date. But there is time to make bold aims. And my call to action to you is in your breakout sessions, be bold. All right. So the North Star is zero missed opportunities. That means that every referral that's ventilated is called in a timely manner, that patients aren't extubated before we have the opportunity to evaluate, that every donor decision is honored. You'll hear more tomorrow about donor management guidelines, that every patient is supported and that critical care endpoints are addressed so that patient has the best opportunity for successful donation. These are all things that you have an opportunity to set a bold aim to. So I would encourage all of you, when you're thinking about how to set some goals for your organization, be bold, right? Even if you don't meet them, you're going to be making progress, which is going to be a meaningful impact in people's lives. At Donor Connect, we set a bold aim of 67% growth over the next 3 years. That's 22% growth over the next 3 years. Through the first quarter of this year, through the first 4 months of this year, we have grown 20% over last year. So we're not at 22, but we've done a lot more to help a lot more people. So I'll leave you with that. Again, I just want to thank you all. This is really incredible. I've not seen engagement like this from a system, and I'm really confident that between your collective efforts and your circle of influence, we're going to really meaningfully impact people's lives. Sure. The denominator is the CDC uses death certificate data. So they look at ICD-10 codes, and there are certain codes that they say this correlates with donation potential. So the death certificates are sent to the CDC. CMS uses that information to calculate our denominator. So the denominator that's the CDC uses is different from, historically has been different from what we in the OPO world count as potential, right? So the CDC doesn't look at CPT codes, so they don't know if the patient was ventilated. It's not an organ potential if the patient's not ventilated. So the defined potential that the CDC has is much higher than we have. At Donor Connect, we have really expanded what our definition of potential is, so we can be more closely aligned with the CDC. So our conversion rates are probably much lower than other OPOs because we have expanded that pool. And I think the reason we're doing that is because things are evolving. Alex talked earlier about hepatitis C and how that was a contraindication for donation, 6 years ago. Now we can recover and transplant 7 organs from that patient. So we would rather be on the side of being overly conservative with or overly aggressive with what we're defining as potential and allow technology to catch up. The scrutiny is there. And we have seen, as Alex has shown, donation volumes have increased dramatically. And I'll be the first to say that level of scrutiny and accountability has driven a lot of that, right? There's a lot of complacency in just doing the same things over and over. So I welcome it. But our mission remains unchanged, right? I don't care what the regulations are. It doesn't change what I'm going to do to try to help and save lives, and same with the entire Donor Connect team and Life Center Northwest as well. All right, be bold, set some bold aims, because again, any progress incrementally is just going to mean more lives saved. So thank you again. Appreciate it.